Haji. So we have the system ready. Let's start with the first round. So the first round will start with the team A. The question will be directly for team A, but the rules are slightly complex. So the rule is that if it is a self question, the score is plus 20 and 0. But there is an option to pounce on the question. So pounce means that instead of answering directly, all teams, including the team where we have put the question to, can raise their hand. Raise their hand. So if there is more than one team who has pounced on it, they can write the answer. They can write the answer, and we'll see the answer on the chat. And at that time, the score will be plus 30, but the minus mark will be minus 15. And and even if it is your own question, you can pounce on it. Instead of answering directly, you can pounce on it. And if the answer is wrong in all of the people who have pounced, then bounce. Yes. So yes. And the second thing is that even if it is bounce, then in bounce also they have to write the answer. They can speak it out. Speak it out. Okay. Very good. So I think we have more or less the rules clear. We start with the team A. So when we finish the question, after I finish the question, don't bounce before that. After I finish it, I'll say, okay now. Okay. And after that, we'll have 5 seconds or 10 seconds or 5 seconds. Okay. And we identify the people. Okay. Let's see. Okay. Everybody on your marks, team A. Team A. It's direct question for you. This is a dry round. This is a dry round. There will be another round which will be more wet, more clinical round. But let's see the dry round first. Okay. This is a 26-year primary gravida, 30 weeks gestation, presents with worsening of non-pruritic jaundice in 1 week. There is no associated abdominal pain, nausea, vomiting, fever. Her antenatal period has been otherwise uneventful. There is her medical history unremarkable, but she had episodes of jaundice during her teens. All of them resolved spontaneously. Hepatitis panel is negative. She is neither a smoker nor a drinker. Pulse is 92. Good volume. BP is 110 by 68. Abdomen is soft, non-tender. LFT normal. Total bilirubin is 4.2, but the conjugated bilirubin is 3.5 milligram per deciliter. Urine corpusculin is 180 milligram uh, into 24 hours, less than 200, and urine corpusculin is 85% of it. Normal is 20 to 45%. Corpusculin type 1, 85%, 20 to 45% is the normal range. And I will now show you a cross section of the liver. Okay, so I don't pounce now. I'll show you the cross section of the liver. Are you clear with the question? Are you clear with the question? Primary gravida, pregnant lady with jaundice, some LFT and are written to you, some bilirubin value are given to you, some corpusculin level are given to you. Everybody understands this? Okay. Okay. Wait. Let me show you the image. So there is an image in the question, and so this question has the visual also, a clinical vignette also. But the question is, what is the diagnosis and what is the underlying defect? Okay. Now you can bounce on it. We want to know the diagnosis. This is the liver on the gross specimen. You have to, okay. Self bounce, team A. Okay, so no other team has bounced on it. Team A, what is the diagnosis and what is the underlying defect? So they are giving answer in written so that other people don't get to know what they have said. Because sometimes what happens is after the first answer is given by the first team, everybody else becomes wiser. So that's why we introduced a round where you can have actually the answers from the written note. Okay, team A, you pounced on it, so negative marking also applies. Now nobody can pounce on it. Now it will only get passed after this. Team A has given the wrong answer. So now we bounce the question to Team B. Team B, now this is your direct question. Team B, they have given a wrong answer. Minus 15, they have already scored. They could have directly answered and gotten a 0, but they were over aggressive in the beginning. In the bounce, there is no negative. They say intrahepatic cholestasis of pregnancy, and we pass on to the team C. They are wrong here. Team C. Ileosis hepatitis is wrong. We did no negative marking, but we give you a 0 here. Okay, team D. He says acute fatty liver of pregnancy, which is a very good answer, but it is wrong. Okay, 0 marks. Team E. Are you asking us? Are you telling us? So we give you 0 marks for this. Team F. Team F, they don't want to say anything. They don't want to say anything. Team F, congenital. Okay, so what I'll do here is I will now pass the question to the audience. Okay, because we have a good question to begin with the audience. Do we have an audience prize here? Do we have anything for the audience? Yes, we have. Yes. He says Dublin-Johnson syndrome, and it is totally correct. Do you want to also tell us the defect also and get a prize? Anybody wants to tell the defect other than the team members? MRP2 is correct. Who answered first? Okay, so both of them get a prize. To begin with, you can tell the year that you are in, and we can give a corresponding book from the section. Okay. So let us now, by the time we give the prize to the audience, the key words were, it is non-pruritic. Non-pruritic, the cholestasis of pregnancy, which usually would have pruritus, would have itching. There is no nausea, vomiting, fever. We tried to rule out hepatitis, and the hepatitis panel was also normal later on. We saw that there were few episodes in her teenage also telling us that this disease was already there. And we saw that the conjugated bilirubin was the predominantly rise, and the type 1 corpupurpurin in urine was high. And then we saw that the liver had that blackish discoloration that we see in, what is the answer? Dublin-Johnson syndrome, and mutation is MRP2. Okay, so interesting question, but I think only team A could score something out of it, but that was minus. Okay, so we go to team B. So I hope you see, I have highlighted a technique for you here. That technique is to find out the keywords and find out what is it that we are trying to rule out. In a long question, it becomes very tricky to find out what is it. So we have to keep in mind, and on the side, keep deducting they are trying to rule out this, get to the answer. So this is why, we have highlighted the keywords for you. That is the key way to look at a clinical vignette. Now, let's see, team B. Team B, we have a direct question for you, team B. Team B from Maulana Azad Medical College, okay? Let's see now. A 45-year-old man for Western Kentucky presents to emergency department with fever, headache, muscle pain. He had a camping trip where they hunted for fish, squirrels, and rabbits. He does not recall any tick bites during the trip, but recalls having several mosquito bites. For the past week, he has an ulceration on his right hand, redness, pain surrounding it. He also has noticed some pain swelling near the right elbow. None of the friends he has camped with are ill similarly. His vital signs are BP is 106/65, heart rate, okay. So okay. Do you want to see the X-ray chest or no? So there is enlarged lymph nodes in the axilla and the epitracheal region, and chest X-ray shows fluffy bilateral alveolar infiltrates. Pause window opens now. Okay, so only the team B has self-pounced. Okay, so I'll ask my team members to look at the answer they are saying. Any other team has pounced on it? Okay, so the team B has given an answer, team C has given an answer. What is the... So team B has got the answer correct. They've got plus 30. Team C has answered it wrongly. They get minus 15 for it. So it's very important to pounce when you know. Otherwise, you are only deducting your own marks. And that is the idea behind high negative marking in such questions in the exam also. So let me show you the keywords. Now I have highlighted the keywords for you. Western Kentucky area, squirrels and rabbits are the key word here. And it is not transmitted person to person, so the friends are not affected. He doesn't recall a tick bite, but could be a tick bite, could be mosquito, could be from the direct contact with the animals. So really he is not able to tell us, but there is an ulceroproliferative lesion with a lymph node, ulceroglandular lesion. There is an ulcer with a lymph node, epitrochlear lymph node is classically enlarged with some pneumonitis in the lungs. Anybody now? Audience, so we have already have the answer. We have had a score. Anybody wants to venture the answer? Yes. Tularemia is correct. So because all of you are telling in together, so there are no prizes to be won. So the answer here is tularemia, Francisella tularinus is the answer. Okay, tularemia is the answer. Your team B has directly answered, so they get plus 30. Very good, team B. Now team C from AIMS. So even before you got your first question, you have your negative markings with you. So I hope you see this is the big change in AIMS exam, because many of your AIMSonians and Mulanians, you are looking forward to give the AIMS exam in future. In your classic AIMS pattern, everybody will tell you to go more aggressive. But now there are certain questions in this exam which are carrying almost 100% negative marking, we have to go a little guarded. So this exam would now require two hats. You would have to be aggressive in the 1/3, 1/4 negative marking questions, and you have to be defensive in the 100% negative questions. So that is the new pattern. So that is why this negative marking hurts. That even before you have heard the first question, you're already on negative. Okay, Team C, direct question for you. 66-year-old female, mild chronic obstructive pulmonary disease, diabetes, hypertension, underwent kidney transplant 1 month back with 2-day history of diplopia, unsteadiness. And she has been feeling generally unwell for preceding 10 days, headache, lethargy. She was apyrexial, no meningismus, but she has ataxic gait, right-sided nystagmus, dysmetria, cranial nerves are normal, right lower limb reflexes are brisk, upgoing Babinski reflex is there, blood tests are showing neutrophilia, blood cultures were negative, HIV virus, Lyme, IgM, IgG, anti-nuclear, anti-neuronal antibodies were negative, CSF shows high protein, normal glucose, high WBC count, and MRI brain is shown to you. Let me show you the MRI brain also, Team C. This is the MRI brain, but I want you to tell us the organism which is implicated in the case shown to you. Do you want to read the history again? Okay. So this is the problem somewhere here. This is the problem. Okay. Do you want me to show you the history again? Okay. So the long question. So I'm showing the history again, and the bounce window is open side by side. Everybody who wants to answer, raise your hand. Team C, this is your direct question. You can directly answer. Also avoid negative marking. Everybody else can pounce on it. So this round is pounce and bounce. You pounce on it, score marks, but when you pounce, sometimes you lose marks also. Pounce window is now over. You can't pounce on it any longer. Team C, your direct question, Team C. She wants to diagnose on the MRI. Very good. Okay. So I'll show the MRI again. Okay. Team C, you want to say something on the MRI? The history is more useful in this question actually. So that is why I showed it again, but now I am not going to go back. Okay, Team C, you want to answer? Should I pass on? So it goes to the team from AIMS, Team D. Team D. Team D, you want to see the history again? I've already shown it twice. What do you say, team? Can we be lenient with them? Okay. The home team says it's okay. You know, we host their guests. Huh? You want to say something? No, they want to say pass. Okay. Team E. Team E. Chance to get some direct marks on the bounce. Cryptococcus, not correct, not correct. Team F, yet to speak something, say something just to make relationship. Cytomegalovirus is not correct. There are no negative marking. They all end up. Team A. Okay, it is still at 0. Team B. Team B. Okay. Okay. So what I'll do now is I'll open the keywords. I'll open the keywords so that some of you can guess. If anybody of you wants to guess now, there is no score for it, but there is a prize from the audience. Anybody can answer now, including the teams can pick on it once we highlight the keywords. Okay, the keywords are kidney transplant 1 month back, problem in the cerebellum, hindbrain, diplopia, unsteadiness. There is again ataxic gait, cerebellum, dysmetria, cerebellum. Okay, so we're towards the hindbrain, some bacterial infection, neutrophilia, chronic meningeal kind of CSF, high protein, normal glucose, and we have the brain, MRI brain also showed some ring enhancing lesion in the hindbrain distribution, brain stem and the cerebellum. You have to add. So what kind of infection would be there in a patient who has undergone transplant 1 month back involving the hindbrain is the question. Yes, and a chronic CSF findings here. Anybody wants to venture out? So do you understand now that how questions become very tricky when they are long in length, because you have to have a long attention span to actually pick up the keywords. This is JC virus, which is not correct. Okay, so should I open the answer for everybody now? Okay, nobody wants to take the answer. The answer is Listeria monocytogenes. This is a Listeria which causes the rhomboencephalitis. The hindbrain is the classically involved, and there's a typical history is transplant 1 month later. This is the typical history. And we had ruled out the, we had shown the chronic meningitis picture in the CSF also. Listeria was the answer. Slightly tough question. but let's see. Okay, listeriosis or listeria is the answer. Okay, now team D. Team D, direct question. Team D, all ready? All ready to bounce and pounce? Okay, team D, now all set. Let's see the question now. Everybody. 54-year-old man evaluated by gastroenterologist for diarrhea that has been present for 1 month. The stools seem to float and difficult to flush down the toilet. They occur any time of the day or night but worsened by fatty meals. In addition, he has pain in the joints lasting days to weeks, not relieved by ibuprofen. His wife notes patient has had difficulty with memory in the last few months, and he has lost 30 pounds and intermittent low-grade fever. He has no medications, otherwise healthy. Intestinal biopsy shown to you. Do you want to see the biopsy? Okay, team D, this is the biopsy finding here. Okay, so all of them has bounced, I think. So we will ask the team to see the numbers. So it will be plus 30 for the correct, minus 15 for the wrong. So I hope you see there is no discrimination that who gets what question. You know, somebody gets a easier question, but then everybody gets a chance to pounce on it. That is the pattern of the exam. Everybody? Okay. Only the team D is, they are not saying anything? Or they are not saying anything? Team D gets 0. They have not pounced. Everybody else has pounced and everybody else gets plus 30. What do you think, everybody, audience? Do you see this? Fat-laden, foamy macrophages. Okay. They can answer still? They can still answer? Okay, they can still answer. Okay, okay. I spoke a little early, but okay, we are very gracious, so we will give them 20 marks for answering. Okay, everybody else get 30, they get 20. It is Whipple's disease. You saw those fat-laden macrophages in the lamina propria. And what were the keywords? Everybody, what were the keywords? You saw the stools were fatty, they were floating, fatty meal was causing selective fat malabsorption was there, joint pain, malabsorption, we added them together, we saw the biopsy picture, and we got the answer as Whipple's disease. Whipple's disease was the answer. Okay, it was a straight away takeaway, but you could have pounced also, and taken 10 more marks, but you lost on that opportunity to pounce. Okay, so it's a slightly difficult round to, because you have to be on your toes to pounce on others' marks also. So it was a direct question for you, but others scored more than you. Okay, so that's not right. You have to pounce. Okay, team E, are you ready for your direct question? All set now. Okay, let me click here. Let me click here to the question. Okay, 80-year-old girl, headache, difficulty in gait, diplopia into 1 month. She also complains of menstrual bleeding a week back. On examination, her vitals are significant for heart rate of 56 beats per minute. Her general examination shows axillary and pubic hair, lid retraction, large pupil, react poorly to light, impaired upgaze, conversion, retraction, nystagmus. Fundoscopy shows papilledema. What is your diagnosis? Team E. And the pounce window opens now. Raise your hand also so that everybody can clearly see. Okay, team B and F wants to pounce, and E has a direct question. They have a chance to answer. They have not pounced on it so far, and the pounce window is closed now. You can't pounce any longer. Yes. So we want a complete answer. Incomplete answer will be taken as negative marking. We are very strict on it. Okay, so we are not going to say the answer now till the time team E also answers. Now we know that it is a very, very critical question, and we know that it is a easier question here. So team B gets full 30 marks for this. Team F has given negative. Okay, so we give them 0. We have given partly correct, but we are not giving you any marks. Okay. Team E, your chance to answer. Team C has not pounced. Team E, your chance to give the direct answer before I highlight the keywords for everybody. Team E, your direct question. There's no negative marking when you're answering it directly. You have not pounced on it. Okay. Team E, thinking of something. There are audience who are getting very restless. They want to answer. They know the answer. It is something like when you are in the exam, everybody else is asking for sheets. Chance to answer now. Team E. Okay, we can't wait endlessly. So I'm going to count 5, 4, 3, 2, 1, over. We go to the audience now. Audience. Oh, I'm so sorry. We have to bounce. Okay, we have a chance to bounce also. F has answered, so we go to C. Okay, we go from F to A. We go to Team A. Team A, your chance to answer. Craniopharyngoma. Okay, we'll hold here. Team C. Okay, Team C, quickly say. We can't sit all day. Team C. Want to repeat what they said? Team C. Okay, they are not saying anything. And then it goes to D. Pituitary adenoma. Okay. F already done. Okay, they have already bounced one. You can't do this. Okay, so all of you are wrong here. You both are wrong. So that's why we did not. Craniopharyngoma, pituitary adenoma doesn't make sense. So let's highlight the keywords. The problem was headache, gait problem, diplopia, gait and diplopia, menstrual bleeding at 8-year-old age, axillary hair and pubic hair. What do you think? 8-year-old woman, girl with axillary hair, pubic hair. What do you think? Precocious puberty is the keyword here. Precocious puberty. Large pupils that react poorly to light but accommodate normally, impaired upgaze, conversion, retraction, nystagmus together is called as Perinaut syndrome. And there is a tumor, papilledema is there, raised ICT is there, bradycardia is there. So there is a tumor causing Perinaut syndrome. How will you localize this tumor? Pineal tumor. So it has to be a pineal tumor would have been the correct answer. Anybody said pineal tumor, we are giving marks to it. So team B said pineal tumor. Team F was not saying. You said partly, so that's why we did not deduct your marks also. You see the graciousness of the quiz team that there was a negative marking, but we did not cut it. So it is Perinaut syndrome, but the answer that we wanted was a pineal region tumor. Even if you said pineoloma, pinealoblastoma, germinoma, we would have taken all the answers. Whatever pineal tumors you would have said, we would have taken them as the answer. Are you clear? Okay. So we are very fair. So even if we are not like a home team, to favor karna aisa nahi hai, aisa kuch nahi. We are all very fair on the exam. Okay, everybody. Now the direct question for team F. Direct question now. Team F. You have a very direct question. Everybody, look at the question. Twin transfusion syndrome is a phenomena seen in monochorionic twins, arising from a presence of single or multiple arteriovenous communications between the two twins. Blood is transferred disproportionately from one twin, that is the donor, to the other, that is the recipient, resulting in decreased blood volume in the donor, increased in the recipient. What do you think will happen to the amniotic fluid and why? Twin transfusion, what happens to their amniotic fluid and why? I want both the things to give you the mark. Pounce window opens. You can pounce on it. Okay. Which team has pounced? Team E. Okay, the pounce window is now closed. Huh? It's open, it's open. Okay, we are very generous with the windows. Team E has the correct answer. They get full 30 marks for it. And the pounce window is now closed. We will pass on the question to F. Has a direct opportunity to answer this question. F, this is your answer now. F, what do you want to say? What will happen to the amniotic fluid here? Twin transfusion, what happens to the amniotic fluid? How is it produced? That is the key to answer here. Team E, Team F. What do you want to say? Quick. Polyhydramnios is his answer. And we are passing on to the team A. Team A. They say normal. Okay, we pass on to the next team. Okay, so save time. Okay, team B. Quick. Yes? It's a twin. Do you want to say something? Okay, they say oligo. Okay, we cut it. Okay, no, we go to team C. So, can you give some technical words also? More amniotic fluid less? What is it looking nice? You telling us today? Yeah? Why? Correct. So that is the correct answer. So this question ends here. They get the pass marks. So one will have polyhydramnios, one will have oligohydramnios. The reason is one will have more urine production, one will have less urine production. So the idea here is that I hope you understand you're telling only one, but I'm asking what will happen to their respective amniotic fluids. Please see this keywords here. It is monochorionic twins. The twin-twin transfusion was the answer. And we said abnormal connections in the placenta leads to uneven blood flow distribution. One will be dehydrated, then he will produce less urine and less amniotic fluid, and the vice versa. Are you able to understand this? So this was the end of round 1 here.